want to do your first forum post, which is the 5 most important aspects of the nursing profession. So I want you to kind of think about the profession of nursing. What are 5 aspects that you have really come to value as part of our nursing profession? I want you to write 1 to 2 sentences on each of those 5 aspects and create a posting of about 200 words. Then by Sunday, I would like you to respond to 2 of your peers. I would like you to ideally find somebody that picked at least 1 aspect that's something different than what you did and respond to them. The second forum post that you're going to do for this week is after you have read Roger Bolger. He is a physician. He writes an article entitled Old Wine in New Bottles. What Dr. Bolger is kind of trying to get across is that we as nurses are in a new era, very similar to what Bonnie Wesrick was saying. As more and more technology kind of creeps into our healthcare environment, how can we, as the wine within the bottles, adapt to this new environment and not lose the heart of kind of what made us nurses in the first place? So I want you to work your way through that Bolger article. It can be a little bit of a challenging read. So I even note in my forum post that this is a great time to use at the top of Moodle with kind of a general conversation posting that was really for you guys' benefit. So if you're struggling with that article, I would suggest that you maybe start there with putting out a post to your peers within the class. Hey guys, I'm not really sure I'm understanding this part of Dr. Bolger's article. Seek some clarity that way before you go to your professor, but you can absolutely contact him or her if you need further assistance with that. So try to get through Dr. Bolger's article, and I want you to answer this question. And in about 2 or 3 paragraphs, I want you to kind of summarize this idea. How can nurses stay grounded in the fundamentals of care and compassion while healthcare grows in its use of technology? And then, of course, as I said, by Sunday, you have your philosophy of nursing paper due. Again, week by week throughout this program, you have been writing papers that have addressed different pieces of this philosophy of nursing. Please do look at the Word document that's posted on Moodle and use that rubric to help guide you in writing this philosophy and theories paper. Have a loved one, a coworker, somebody maybe proofread your paper to make sure that, yes, indeed, you did address each of the sections of that rubric. If you do that, you're going to be well on your way to covering what we're hoping that you cover in that paper. And again, this is in the syllabus as well of kind of what we're looking for in that philosophy and theories paper. For this week, as we look at nursing as a profession, we are going to look at the concept of communication and how important that is. Knowing that we work in an interdisciplinary setting where we are needing to be congenial with all sorts of people. There are a couple of different articles posted on how you present yourself professionally, how you deal with a disruptive provider, and then creating a culture of civility in your workplace. Oftentimes healthcare, just due to the different power struggles that happen within healthcare, it can easily become a place of incivility. And how do we maybe work our best at creating really civil cultures in which the patient really feels safe and cared for? So best of luck in getting through your philosophy paper this week. I am going to go through 2 PowerPoints here with you. One is around communication and how you deal with a disruptive practitioner, and then the other one will be on nursing. So when you have a disruptive physician, or I'm going to call them practitioner, because again, I have worked with many neonatal nurse practitioners, and they can have equally poor behavior from time to time. So again, I prefer to call this a disruptive practitioner rather than physician behavior. If you are faced with somebody that is being disruptive, how should you respond? Knowing your chain of command of who you take your concerns to. It is said that 96% of nurses have experienced disruptive behavior by physicians. Oftentimes, nurses are the primary victim of this type of kind of violence or outburst. It really serves to undermine patient care. It causes staff to feel dissatisfied, disempowered, all these things which lead to nurses wanting to leave the bedside and just a turnover problem for your facility. The Joint Commission does require that hospitals develop a code of conduct for their physicians and practitioners, and they are to manage a process for kind of disciplining them as these behaviors come to light. There are 4 types of disruptive behavior that you could be a part of or witness. One is entitled intimidation and violence. I have worked in places where pencils have been thrown. You hear of much worse things than that, but throwing objects, threatening violence, pushing somebody or actually hitting someone, even finger pointing where you're really in someone's personal space or yelling at them, are all tactics of intimidation and violence. Clearly, anytime that inappropriate language or comments are used, these could be racial, ethnic, or socioeconomic slurs. This could be profanity or obscenities, sarcastic, cynical, or demeaning remarks like, oh, of course you didn't do that. I mean, anything that's served to demean somebody or belittle someone can fall under this. Clearly, sexual harassment is never acceptable. And this can include jokes about sex, comments that have a sexual kind of overtone or innuendo to them. The other thing that I think is really interesting, but can be a part of kind of this disruptive practitioner behavior, is just an inappropriate response to patients' needs or staff requests. Maybe you know this doctor that just never gets back to your pages, or you do get a hold of this nurse practitioner and he or she is just really inflexible in responding when you're calling for assistance. There could be retaliatory notes in the medical record, disregarding policies, blaming others for adverse outcomes, and then oddly enough, really rounding at odd hours where they don't have thoughtful consideration to the flow of the unit and what's typical and what really meets the needs of the patient. So even something as disruptive as I'm gonna make you fit into my schedule and round when it suits me can be kind of a form of this passive aggressive behavior which really isn't responding to the needs of the patient. So what do you do when you witness these behaviors or are part of these behaviors? Clearly the best thing is to use some kind of mnemonic. There's a number of them out there to help you kind of know how to go about approaching this. One is CUSS, which starts with I have a concern. Obviously talking with the provider about the disruption is maybe the best first step. We do recommend that you have a supervisor there with you so that there's more than just yourself approaching them. Clearly you would want to file a incident report using your institution's kind of system for this. Once those reports are filed, again, as I said, the Joint Commission has dictated that there be a process in place for reviewing those. And that process is usually that the head of the medical staff is the one that meets with that provider. And the provider is advised that any retaliation against the person reporting would be grounds for immediate dismissal. So you need to feel safe in reporting that should they retaliate against you, that should be grounds for immediate dismissal for them. If the person reporting, if the person reporting is concerned that the CEO of the agency will investigate, and then they will send that on to the president of the medical board. So again, you do have power. If this was to happen to you, you need to do your chain of command in making sure that this is dealt with appropriately. looking at the meta paradigm of nursing, we know that, again, nursing is a piece of our meta paradigm. We have person, environment, health, and nursing. What is the good of the paradigm? What is nursing? It is an academic discipline in which we have our own theory that's specific to nursing. We have a professional practice. We have skills and knowledge that we put into action. It is also considered an art, where we are given the freedom, the autonomy to creatively apply our own nursing knowledge. And it's also a science, that we have the ability to critically think through the scenarios that are presenting to us and provide our own clinical judgments. Martha Rogers defines nursing as a humanistic science dedicated to compassionate concern with maintaining and promoting health, preventing illness, caring for and rehabilitating the sick and disabled. Nursing seeks to promote symphonic interactions between the environment and the person, to strengthen the coherence and integrity of human beings, and to direct and redirect patterns of interactions between the person and the environment for the realization of maximum health potential. Dorothea Arms, she says, nursing is a helping or assistive service to persons who are wholly or partly dependent. This could be infants, children, adults, when they, their parents, guardians, or other adults responsible for their care are no longer able to give or supervise their care. A creative effort of one human being helping another human being. Nursing is a deliberate action, a function of the practical intelligence of nurses to bring about a humanely desirable condition in persons and their environment. It is distinguished from other human services and other forms of care by its focus on human beings. Rosemary Parsay, Human Becoming Theory. Nursing is a human science that focuses on the quality of the client's life from the client's perspective and involves innovation and creativity. The nurse is responsible for guiding individuals and families in choosing possibilities for changing the health process. What did you write about the concept of nursing? What 2 ANA codes of ethics did you include and why? And what 2 ANA clinical standards did you include? Again, here in an online setting, you're not going to be able to gather into a group, but I just want you to think about these questions of what did you choose? Why did those stick out to you as being the most important? The ANA defines nursing as the protection, promotion, and optimization of health and abilities. It is the prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of the human response, and advocacy in the care of individuals, families, groups, communities, and populations. Nursing is based in theory, research, and practice. We know this. Where is the art of nursing in your own nursing practice? Where is the science of nursing in your nursing practice? Thank you for watching this tutorial video on week 6, and hang in there. You've got one more week to go and you'll be through Nursing 331, Philosophies and Theories. Bye.